I always envisioned, hey, I'm going to throw baseball with him, play football, and grow out golfing. And that all changes.
His preschool teachers pulled Tim and I aside at a conference and said, Amber and Tim, we think something might be going on with Austin physically. He doesn't seem to be moving as well as other kids his age.
He would waddle instead of walk or run. He just had a little funny gait to him. And he never was able to fully walk upstairs. It was always crawling upstairs.
Austin has very enlarged calf muscles, and that is a main sign of Duchenne.
His speech development was delayed. And all this time we always thought he's going to catch up with his other kids. He's just developing slower than our kids. Checking CK levels can be a quick indicator of, the diagnosis for muscular dystrophy.
Jude is just the normal 6-year-old boy who loves being creative and he likes playing video games.
His kindergarten teacher actually at the time had noticed that he had some problems with using scissors. As a mother, I was thinking, well, my kid is just like any other normal kindergarten kid.
We've been doing this physical therapy for a year and it's just stiff muscles. That's all. We just got to build his core and he'll be fine. And in the very first session with the new physical therapist, just observing and getting to know Jude, had noticed how he was getting up off the floor and how he was moving around the room. Just being able to do a CK test early, I think, would have been huge for him.
When you're dealing with a progressive neuromuscular disease, you really have to be ahead of the disease process. Especially as physical therapists, we're constantly doing assessments on that child to see where they are in that disease progression. Typically, Duchenne muscular dystrophy is diagnosed at around 4.5 years of age on average at this point in time. So pediatricians and family practitioners can be looking for signs of muscle weakness from a really early age, even in infancy. They can also make sure to look at a few things when they're there with the patient as they get older, such as watching them get up from the floor and walk or run in the hallway. They might see what we call a classic Gowers sign, where the child needs to push on their legs or use furniture to help rise into a standing position. And they might even see them walking on their toes. They can take a look at their calf muscles. We often see calf hypertrophy or enlarged calf muscles. They can also do a simple blood test to look for creatine phosphokinase levels or CK levels. It's just so critical that pediatricians, family practitioners, physical therapists are really mindful of all the signs and symptoms of Duchenne muscular dystrophy so they can get that early diagnosis, so they can get the care that they need to have the best possible outcomes.
We are the window to Austin's world. So the way we are painting the picture for him is how he's going to observe and see the world. And I want that to be beautiful for him.
ChildMuscleWeakness.org is a resource created by the National Task Force for Early Identification of Childhood Neuromuscular Disorders. The goal of the website is to increase clinicians' awareness of neuromuscular disease as a cause of developmental delay in young children and to help providers in primary care, rehabilitation medicine, and physical therapy identify the early symptoms of neuromuscular disorders. There are FDA-approved therapies, published standards of care, and clinical trial options available for Duchenne muscular dystrophy that may improve outcomes. A delay in diagnosis may result in a patient with Duchenne missing appropriate therapies and services. ChildMuscleWeakness.org features a motor delay algorithm which recommends a serum creatine kinase, or CK level, as a first step when evaluating a child who is not meeting milestones. An elevated CK level allows for prompt referral to a neuromuscular specialist for diagnostic evaluation and genetic testing. This website also includes a wealth of resources, publications, and a video library to demonstrate core signs of muscle weakness in children. We urge you to explore this important resource and remember, when you identify a developmental delay, order a CK.